And we are live. Hello, everybody. Please let me know in the comments if you can see us well. Please let me know if we are audible. Let me just check if we are visible in Tribe. Let me know which city you're joining us from. Yes, we are very much visible and live. Okay. Let me know which city you are joining us from. Hi, everyone. I'm Dr. Shweta Poddar, and a very warm welcome to all of you on behalf of SuperBottoms. The session that we are here today for is Pregnancy Nutrition, Trimester by Trimester. And for this session, we have with us Dietitian Sahiba Aggarwal. Sahiba is one of the leading dietitians in Mohali. She has completed her MSc in Dietetics and Food Service Management from Indira Gandhi National Open School. She has her expertise in diabetes management, stress management, pregnancy dietary management, PCOS, PCOD management, meal planning, and patient counseling. Welcome to the session, Saiba. Any opening thoughts
Thank
for
you.
the session?
Yes, definitely. First of all, it's a pleasure to be here. And secondly, it's very important to manage your diet during pregnancy. Uh, in every day, we keep it in our mind what to eat and what not to eat. But a lot of thinking and processing goes around. Shall I
Yes.
eat this and shall I not eat this? So it's very important that we conduct such a session and we give a guidance to everyone that what is the right amount of food you should consume. So yes, I think it's going to be a fun activity, and definitely we'll take some questions as well. So
Certainly.
I'm so excited. Yes.
So, tribers, just so all of you are in loop, one lucky commenter is going to win a goodie from Super Bottoms. So, go ahead, please write down all your questions so that Sahiba is here and she's going to answer all of the queries today. So please ensure you write all your questions in the comments below. Without any further ado, let me just dive into the first question. So, Sahiba, what are the crucial nutrients that pregnant women should focus on during the first trimester?
Okay. So first of all, as we are even planning for pregnancy, it's important before even planning for pregnancy that every female should have good iron levels, and she should start taking her folic acids beforehand itself. So it becomes very easy to continue and plan further with the pregnancy. Also, it becomes easy to conceive when your folic acid is complete in the body. So during first trimester, once you entered the period and now you have conceived, it's very important that you make sure you're taking proper amount of macronutrients and micronutrients, meaning like having proteins, carbs, and fats in appropriate amount. First of all, secondly, then you're having your proper vitamins. As you will visit your gynae or you will consult your gynecologist, she will guide you with your folic acid tablets, the amount of folic acid you need throughout the day, multivitamins you need throughout the day, and how you are going to continue it through month. So it's very important that you keep a focus on proteins and vitamins first of all in first month, and also the amount of water you start consuming from day one. It is very very important. We forget this small thing.
Right.
Yes.
And we notice that a lot of women, I think there's an echo coming.
Sorry.
Okay, is there another device that is switched on from your end?
No.
No, okay. I could just hear an echo, so I thought I'll just ask you.
No, no, everything is.
Okay, okay. So, a lot of women face morning sickness during the first trimester, also throughout the pregnancy. So, how
Yes.
can morning sickness and food aversions impact a woman's diet during the first trimester, and what strategies can help overcome them?
So basically, food aversions is at peak from week 14th. So the thing is that what the major reason is low iron levels. If any women is facing food aversions or morning sickness, or there is a lot of having taste issues in diet, it is majorly because iron levels are very low throughout the day or even beforehand. and there is lack of multivitamins in diet. During aversions we throw up a lot, so there is definitely dehydration in the body. So what everyone can do is they can plan meals like the triggering food. Try to avoid those foods if you're triggered by caffeine, tea, onions, or garlic, because everyone has a different aversion. Some get uneasy with the smell of soap, and some get uneasy with phenyl. So you need to stay away from those triggers, because that can impact your health very much. First thing is this: now while cooking, if certain foods make you uneasy, try to cook in the area where there is a lot of ventilation. Open windows and try to ventilate the area so that it doesn't affect you so much. Secondly, you should experiment with foods. If certain foods are causing uneasiness, nausea, or you are not feeling good, then have soups or broths. You can consume juices in or blended smoothies. Take your proper nutrition through smoothies and soups. If you just can't take the vegetable, a particular vegetable, particular dal, or something in particular, if you're getting allergic to some fruit, like that fruit is causing some sort of acidity, then try to blend it in some form and consume it. Similarly, if certain vegetable is causing you some sort of uneasiness or aversion, so what you can do is, rather than completely avoiding it, you can just blend it in your atta and make roti out of it, and need a dough out of it. So at least you will consume nutrition. Don't
Right.
stay away from that nutrition. But yes, if it is if the kind of aversion is that you cannot tolerate, then please totally avoid that food if it causes a lot of disturbance to you throughout the day. So that is
Right.
one way to. Yes.
And can you provide tips for ensuring proper folic acid intake during first trimester? Because
Yes.
it's vital for fetal development. So how can we
Definitely.
ensure that?
Yes. So first of all, everyone should make sure that you are having your dark green leafy vegetables. As we always tend to feed these green vegetables to our kids, or when we were kids, our parents used to say that have green vegetables is important, but it is definitely important. Once you start having your dark leafy green vegetables like spinach, lettuce, broccoli, you are consuming your folic acids from there itself in natural form. So including those throughout the day, like divide your dark greens in rotis or in dals. You can add like ghiya chane ki dal with some moong palak. You making recipes out of those greens, adding sprouts into diet, taking a small piece of dark chocolate. So consuming folic acids to different sources will also help to maintain the levels, and also taking the folic acid tablet which gynae suggests, because you need to consume 400 milligram throughout the day. So that is very much important. Sorry, micrograms.
Okay. Now,
Yes.
moving on to the second trimester, what nutritional changes should women make as they enter the second trimester? And why is iron intake particularly important?
See, iron intake is so much important because baby starts growing. So at this stage, and for fetal growth, we need blood. Iron creates hemoglobin. Hemoglobin is a major source which travels in your blood. It carries oxygen. So iron levels need to be maintained. Hence, we take folic acid beforehand from initial days. So you need to continuously take folic acid from
Doctor, I lost you. Viewers, can you please let me know if my screen is frozen or Sahiba's screen is frozen? To me, I think her screen is frozen. Hello? All right. Till she joins back. Okay, Sahiba's screen is frozen. Sahiba, could you please tell other Sahiba that her screen is frozen? She probably is not aware, so you may have to give her a call. Okay. Till we have her back in the studio, let me just quickly refresh. One lucky commenter is going to win a goodie from SuperBottoms. So please ensure that you leave a value added comment under this live session, and one lucky commenter will be picked, and we will send them a nice goodie from our end. So let's play a small game till Sahiba is back. What were your cravings and aversions during your pregnancy? Please let me know in the comments. Was there any particular food that you liked?
Hi,
Yes, we're
am I
back.
audible?
Yes, you're audible and you're back.
Yeah, I'm sorry. Actually, there was some network issue.
All right. So please continue.
You're not audible to me.
Are you not able to hear me? Tribers, if please let me know if I'm
Yes,
audible
yes,
to you.
yes, definitely. So I think we were talking about importance of iron levels in second trimester. So it is so important that once you start consuming iron, I was talking that whenever you're consuming beetroot, spinach, or black chana in your diet, make sure that you don't take dairy products with iron because calcium will inhibit the absorption of iron. So if you're having your paranthas and sabjis,
We lost you again, Saiba. Yes, you're back. Please continue.
am I audible?
Yes, you are. Please continue. We can hear you, Sahiba. Please go ahead.
Okay, my screen got frozen. Yeah. So I was just talking that avoid taking dairy products with iron products. So whenever consuming iron, just plan your tea, coffee, any dairy product after 30 to 40 minutes. That is the main thing that everyone can keep in mind. Or even if you're having curd, so make sure that you are not mixing curd and beetroot, or you're not mixing curd with spinach, like you're having spinach roti with curd. So that will definitely inhibit the absorption of iron, and it's not going to be any beneficial for you rather than just a taste enhancer. Same is with palak paneer. That is one of the most famous dish. Everyone loves it, but it doesn't provide any nutritional value in the end. So keeping these points in mind will help to get more iron throughout the day. So iron is
Yeah,
very important.
right. So we do have some interesting viewers' questions. Let's quickly jump to that before we move on with our next question.
Okay.
What do we do if some smells makes you uneasy in whole pregnancy and cannot be avoided, just like curry leaf and capsicum?
Uh, you can avoid curry leaves if you feel very nauseated with it and it doesn't make you any less like after certain time period you doesn't get fine. So staying away from curry leaves can be considered, I think, and even capsicum because there are so many vegetables, so you can avoid it for certain time period. We don't necessarily need to consume it.
Okay.
Yeah.
The next question is, can you tell if fruits and veggies juices are good or for consuming them directly is good? Okay. Should they
Okay.
have
So
juices or should they have these vegetables and fruits?
always, yes, always go for fruits over juices. I never suggest juices because see, if I allow you two fruits per day, so that is you're limiting and restricting yourself to two fruits only, according to your basal metabolism rate and your height, weight, and gestational vitals. But if you're consuming a glass of juice, it might contain like 3 to 4 oranges or apple or pineapple. So you don't know how much amount of fruit you're already consuming. That can create a lot of havoc for you, like over consuming calories. So stay away from juices, and also it doesn't have fibers. So our main concern regarding food is that we are taking fibers throughout our day and in diet, including a lot of fibers. So opt for your fruits. You can peel the skin because there are a lot of pesticides these days. So you can peel skin of
apple or pear, but then consume one fruit at a time, not even mixing fruits. It's not advisable.
Right. Okay. The next question is mostly women gain weight after delivery, but in my case, I started losing. I eat proper but still becoming underweight day by day. Even my baby didn't feed much. Please help.
So, in such case, I would like to know what is the trimester, what are the vitals. I need to know the proper details of the patient. So, it's not easy to diagnose like this. What is the matter with the client? So that is the reason. Like because I don't know what is the metabolism. Are you thyroid or diabetic patient, and what is the history, and what foods are affecting you right now? So
Right.
that is, yeah. So answering on such platform is not a good way. It's always considered that you can contact me post the session.
Okay. How to control hair fall postpartum? I take supplements, but still hair fall is uncontrollable and makes me worried. I take good iron food also.
Yes, include proteins also in your diet. You make sure that you have proteins in each and every meal throughout the day. If you're having your breakfast, take moong dal chila, besan chila, sprouts in your diet. Then have your dal, rajma, black chana, and even in your dinner, if you're having, take some paneer, tofu. So including protein with iron is a very good way to control hair fall. That is the balanced diet is the only way, and you can also consult a dermatologist if it's excessive more than normal hair fall. So going to a dermatologist will definitely be helpful. They can guide you with proper details.
Can PCOS affect baby in the womb? I didn't know I had PCOS and I feel my baby has more body facial hair because of it. Kindly clear this doubt.
See, we have so many patients in our hospital because today every woman is almost crossing 30s when she is getting pregnant or delivering a baby. So PCOS is very common. So I haven't read any research paper that PCOS causes a lot of facial hairs or otherwise hairs on baby. So really don't know about this that PCOS has any concern related to the overgrowth on baby hair. So I would say that I don't have answer for this because I haven't read any paper. But if you think and it's like a if people are saying around you, so maybe it could be a myth. Try doing some research on reading Google Scholar, some papers on it. Then you will get a clearer picture because PCOS doesn't have any link with growing hair on other individual. Rather, you can have in severe cases that you have facial hair on your chin or your cheeks, but I've not read or heard about growing hair on babies.
Okay. The next question is I have seen many drinking collagen powder while pregnant. Is it really good?
See, I never suggest taking artificial things during your pregnancy. My main idea is to always eat what you have taken throughout your when you were growing up. So eating desi and local food is best. Eating homegrown food is best. Taking all the items through your natural diet is always best rather than going for artificial things. Though it is very much common these days, but I don't advise taking it in your diet, including it in your diet. It's advised that you consume your whole grains, vegetables, your seasonal fruits, and staying hydrated through good amount of water, coconut water. That is the best way to continue pregnancy.
Okay. What
Yeah.
would be good to have with milk after delivery? Like women Horlicks or protein drinks.
Okay, so see, that's a personal choice. I cannot endorse what you should have it in your milk, but anything is good to go if it suits you according to your body. If it's not inhibiting in any way to you, not you're not having any allergic reactions to those products, so you can have anything. And milk is a good option. You can include even plain milk, or you can have a lychee milk or turmeric milk in your diet. That is also a good way to take calcium source.
Okay. Does rheumatic affect baby while in pregnancy? Because I have rheumatic and I am 3.5 months pregnant.
Rheumatic arthritis?
I I believe rheumatic fever. Please clarify whether you're talking about rheumatoid arthritis or rheumatic fever. So Saiba can answer us in detail
Yes,
because
and also the thing, yes, to answer this such questions as well, I would always say the audience who is watching this that please always consult a doctor whenever you are having something not which is not normal or going beyond normal. If you are going through something which is not making you fit and healthy right now, please consult your nearest doctor. That is always advisable rather than consulting it online like this. But we'll answer your question if we have proper details, like what you are trying to ask.
please share the details if you can, and she would answer as much in detail as possible online, not more than that. Are dairy foods good for our health? If not, then how can we substitute them?
Yes, foods you're asking, dairy products, right?
Yes.
Yes, why not? Dairy you need to take throughout your pregnancy because you need calcium. So definitely go for dairy products. If you are not lactose intolerant, then why not to take dairy? The question is this: your baby bones, teeth, nails, everything needs growth, and it can only happen with vitamin D and calcium. So consuming both is good. The only good source is dairy, as we all know, or you need to consume non-veg diet. So consuming meats in your diet or eggs in your diet. So go for dairy products. It's good, but make sure that you're having skimmed milk over full fat milk.
Okay. What all food should I consume for less bloating?
Okay, yes, that's a good question. So usually during our third trimester, we feel that we have a lot of bloating. So try not to consume raw veggies, raw salad, certain fruits, yeah, or citric fruit also sometimes cause bloating. But stay away from raw salads. Blanch them whenever you want to have your lettuce or broccoli. Blanch them or heat up some, steam them, so they won't cause you a lot of bloating after getting heated up. So that is a good way. Sometimes cucumbers could also cause a bloating. So you need to keep a check or maintain a food diary that what particular foods are making you bloated. You need to go through that. And also slow eating helps a lot. Try to watch that how fast do you eat. Are you always in a hurry to complete your meal or are you consuming a lot of spicy foods? That then you can get a lot of bloated or bloating issues throughout the day.
Okay. So we have the answer from our previous question. That is rheumatic arthritis, she says. So does rheumatic arthritis affect baby while in pregnancy? She's 3.5 months pregnant.
Okay. So see, basically, it won't affect you like that if you're keeping a check in your diet. You need to consume your diet throughout your pregnancy. Make a balanced meal plan for you. Get a nutritionist. She will plan a diet for you, which will include proper amount of macro and macronutrients. So keeping a check on that won't affect your baby. So, yes, that is the way to have a healthy pregnancy.
Yes. How much hemoglobin percent do we ladies must have in general?
See, every lady has different. So a generic value is nothing. Suppose you are 30 years old and your weight is 80, your HB level will be different. And somebody is just 21 years old and pregnant with higher metabolism, their HB levels will be different. So 12 to 14 range is considered as normal. And we also focus so much on taking iron levels throughout pregnancy is because women tend to become anemic, so it's very important that you consume iron through food specifically so that your iron levels are good and you don't become anemic in pregnancy because anemia causes a lot of high risk pregnancies and it is also not good for your baby. The major reason for baby's brain development or spinal cord development is choline and iron levels or vitamin B12 in the body. So consuming all the vitamins is so necessary.
Okay. So the next question is, in my hometown and nearby area, people used to suggest milk rusk along with milk for good amount of milk produce for mother. Is that true?
No, that's a myth. See, logically, that doesn't make any sense. You're just consuming calories through consuming bakery products, milk rusk. So it is a good amount of carbs with sugars. So if your diet, the way you have planned your diet, post lactation diet, if it is having good amount of macronutrients or carbs, proteins and fats in equal amount of ratio, you don't need to consume any bakery item. Just by having your rotis, rice, idli, sambar, dhokla in your diet, whatever is your meal throughout the day, you will produce good amount of milk and your lactation will be good. But this is totally a myth that you will, if you will take milk rust, and then your milk production will increase. Yes, including good amount of water levels, maintaining good amount of water levels and green veggies with whole grains will definitely help in a balanced diet. So focus on that.
Okay. Let's take a last few questions. Can
Yes.
we consume coconut water during pregnancy, as this is the only food my entire family and many others reject, having it stating different reasons? Please advise.
It's totally safe to consume coconut water. I have no idea like why there is so much of myth going on around it. Coconut water is full of nutrition. It has so much of nutritional value. If you are not diabetic and if you are not having any gestational diabetes, then you can definitely have coconut water. And if you are not allergic to any such item, then go for it. It's totally safe to consume.
All right. And the last question that we'll take for today is, midnight hunger in pregnancy, what can we eat?
Okay, yes. For midnight, whenever you have cravings, you can just. So it is a very good form to consume calcium in your diet. You can have some shira. If again, if you are not diabetic or your insulin levels are normal, then you can have shira in your diet. You can make from suji and keep it alongside your table, and then having milk or a small amount of laddu in diet is also advisable. Post dinner options whenever you feel hungry.
Great. Thank you so much for sharing all these valuable nuggets of knowledge with us. Thank you for sparing your precious time and being with us here today. Have we missed out on any important points according to you?
Yes, I think the major thing around third trimester is that everyone should keep a check that water levels are up to the mark, because many females miss water during this time, and which is the leading cause of UTIs or low amniotic fluid. So please maintain 3 liters of water throughout the day. Also, you can add soups in your diet, like including water liquids in your diet through soups, dal soups, or in general dals in your diet, so that you are consuming more water. So it is much advisable. Also, please stay away from junk food. Even if you're craving, it's not at all good for your baby. Having junk food will create a havoc because it has amino acids. Sorry, not Ajinomoto, and it can cause irritation for the baby, baby's mental growth, and even for you. So stay away from junk foods. That is the main thing. And secondly, preservatives and additives in chips, or whenever we crave that we need to have something crunchy. So it's advisable that you make something at your home and keep it for yourself, which is homemade. Homemade preparations are safe to consume. Don't opt for Lays or any such thing which is packaged, food. It has a lot of additives and lots of salt. So you should go a bit low on salt in your third trimester, as it can make your pregnancy a bit risky. Also, throughout pregnancy, we should make sure that we are not eating for 2 to 3 people. It is again a myth. The last point which I would like to clear is that one should eat only as much as you are hungry, because you only need 350 calories extra, not more than that. So if you feel that if in near and dear one says that you need to consume more now because you're pregnant, that's again a myth. You only just need handful of stuff more. That's it. So I hope that was a good session and I could clear all your doubts today.
Great. This was a genuinely insightful session because you busted quite a lot of myths today. I'm so glad for all the answers that you shared with us. I'm sure all the tribers are going to have so many takeaways from this session.
Thank you so much. It was great to be here.
Thank you once again. And thank you, all the viewers, for tuning in and joining us in this session. Stay tuned for more interesting sessions just on Parent Tribe by SuperBottoms. With that, it's a wrap on today's session. Thank you so much.